Hi guys, today's topic is individual classes as a spatial form of organizing speech therapy work with children. The main questions. First, course individual forms of speech therapy work. Second, individual speech therapy classes. And third, individual classes as a spatial form of organizing speech therapy work with children with impaired sound reproduction. The course individual forms of speech therapy is an important link in the professional training of future speech therapists. The content of the discipline is aimed at mastering students' knowledge, skills, and abilities of organizing and conducting individual speech therapy work with children with various speech pathologies in preschool and school settings. Speech therapy work is a correctional work aimed at the development of all components of a child's speech and organized in accordance with their age characteristics and compliance with psychological and pedagogical conditions. Individual speech therapy classes are classes that allow you to correct individual speech deficiencies of a particular child. Individual speech therapy sessions are conducted if the child has problems establishing contact with other people. If it's difficult for a child to communicate not only with adults, but also with peers. An organized individual lesson allows the teacher to build the relationship with the child, on the basis of which all correctional speech therapy work is subsequently built. Thus, the individual form of speech therapy allows you to optimize the time spent and go to the formation of the child's necessary speech skills, as well as correct existing speech disorders. When we are organizing an individual form of speech therapy, a speech therapist must meet a number of requirements and conditions. These are, first, a clear and understandable formulation of topic and purpose of speech therapy correction classes. And second one, think through each stage of the lesson and their logical relationship with each other. Third one, planning the gradual complication of speech material used in set of classes. And next, base it on a differential approach to each child, taking into account the exciting speech defect, individual and age characteristics. And next, the instructions are short and clear must be. And next, use of various and colorful visual material. And the last one, creating a positive emotional background for the training session. The main purpose of the individual form of speech therapy is the initial formation of the sound side of speech. The content of an individual speech therapy class includes practical speech material that is understandable and interesting to the child, which helps to increase the child's speech activity. For example, when organizing an individual speech therapy session with a preschool child, it's advisable to use lexical and grammatical games and games for the development of higher mental functions. Structure of individual speech therapy classes. First, conducting finger and articulation exercises. And second, setting and automating a specific sound. And third, analysis of the planned lexical material. Next, speech exercises with an increase in the rate of pronunciation, from slow pronouncing to tongue twisters. And the last one, complication of lexical material, transition from a simple type of speech activity to a more complex one. The material used by the speech therapist should contribute to creating a psychologically comfortable atmosphere, enriching an emotional and sensory spheres of the child, developing monological and dialogical speech, increasing motivation to improve their own speech, artistic and aesthetic orientation of speech, fruitful cooperation between the child and the speech therapist. The main task of individual lessons is the initial formation of the sound side of speech, given that the phonetic level is the material basis on the language system. Its violation often leads to the disorder of other higher levels. Implementation of the main tasks in the course of individual classes includes a set of preparatory articulation exercises, correction of pronunciation of defective sounds, syllabic structure of the word, development of phonemic perception. An essential feature of individual lessons is the preliminary practice of articulation of sounds and their initial distinction before studying in frontal classes. In the process of conducting individual classes with children with impaired sound reproduction, the task is to find the most effective ways to form pronouncing capabilities, greeting, and articulation ways that would ensure the most successful acquisition of correct pronunciation skills. The work uses the usual techniques of sound correction. Okay, therefore, some questions to reinforce. First is, what is a speech? Answers: semantic shades of words, articulation of sounds, a set of sounds, or spoken words that have a semantic load. Second question, what is the organs of speech? First, organs of articulation and voice formation. Next, the tongue and lips, or tongue, lips, teeth, and lower jaw, or tongue, lips, teeth, lower jaw, vocal cords, and lungs. And third question is, the peripheral speech apparatus consists of the following departments: voice, articulation, or respiratory. Okay, now you have a time to answer for these questions. And they're given some main literature that you can use to prepare for our practical works, yes? Okay, see you.